Welcome back. I'm Veronica Dela Cruz. More than half of Americans with health insurance struggle with getting the coverage and care they need. That's according to a survey by the nonprofit health research group, the Kaiser Family Foundation. 58% of those surveyed said those obstacles include denied claims, provider network problems, and pre-authorization problems. A new report by the Inspector General's Office of the Department of Health and Human Services shows many private health insurance companies paid by Medicaid deny millions of requests every year. And that includes Elevance Health, formerly called Anthem Blue Cross Blue Shield. The denial in coverage prompted this protest last year at Elevance headquarters in Indianapolis. Members of the progressive grassroots organization People's Action were protesting insurance claim denials for treatment recommended by medical professionals. And they want the company to overturn existing denials and release the process and demographics for coverage denials.
You want to know the truth about where these claim denials are happening, right? Whether they are disproportionately impacting urban or rural folks or black people, right? And it's simple as that. It needs to be known.
Joining me now is Wendell Potter. He is a former Cigna executive and also the president at the Center for Health and Democracy. Wendell, good to see you. Thank you so much for being with us. Explain to us how we got here, Wendell. Why is Elevance denying these claims, and what is the impact to both the consumer and the hospital?
I think they're doing it to maximize profits. Elevance has become one of the country's largest corporations, and it's got a very healthy profit margin. And with these big insurance companies that are for-profit, and there are 7 big for-profit insurance companies, they're under constant pressure from Wall Street to protect those profit margins. And what we're seeing is that in many public programs, Medicare Advantage and Medicaid, these companies are denying an inordinate number of requests for treatment, far more than they're denying for people who are enrolled in their so-called commercial plans, people who get their coverage individually or from their employer. So that's what's going on. And the Office of Inspector General, which is part of the Department of Health and Human Services, did a recent report that showed that Elevance was way up there. And that's at least one of its health plans. It was denying Medicaid plans. It was denying more than one of every 3 claims, or not claims, but requests for coverage. And what that means for patients and doctors is that patients are not getting the care that they need in many cases. And it requires doctors to jump through more hoops to file appeals and to try to advocate for their patients. And we're seeing undoubtedly that people are not getting the care that they need. And that can be very, very detrimental to people's health.
So, Wendell, why is this happening? I mean, the passage of the Affordable Care Act was supposed to end many of these types of insurance industry denials. Why are we seeing so many claims being denied? How are insurance companies getting away with this?
They're getting away with it because federal regulators are just not paying close enough attention. When you have that many claims or that many requests for treatment being denied, that means that the people who are supposedly looking after our best interest and our money, because when we're talking about Medicare Advantage and Medicaid, we're talking about public tax dollars, our dollars, and they're just not paying close enough attention to it. And that's got to change. Senator Sherrod Brown of Ohio recently sent a letter to the Biden administration with 300 members of Congress co-signing it, calling on the Biden administration to do something about that, because it is within the Biden's administration's purview to act on this. But that was for Medicare Advantage, and this is even worse. We're seeing that the denial rates in many cases for people who are enrolled in Medicaid, and Elevance manages Medicaid programs for about 20 states, that they're just making money hand over fist, and one way they're doing that is by refusing to pay for needed care.
So you're saying that insurance companies are doing this in order to maximize profits. I want to go ahead and pull up an article that you wrote, Wendell, which shows us the salaries in 2022 for the CEOs of 7 major health insurance companies, including Elevance. Can you break down how these CEOs make millions of dollars every year when nearly 100 million Americans are dealing with medical debt?
One of the ways they get paid, and it's a major way they're paid, it's not just that they get a salary. They do get very, very good salaries, but most of their compensation comes in the form of stock grants and stock options. And the better these companies satisfy Wall Street's expectations, the more that stock price goes up. And that means that these people are making much, much more money because of that arrangement than the rest of us do. Most of us don't have a deal like that. And these companies, Elevance in particular, is in a big dispute in Ohio and Virginia and other places with hospitals that treat a lot of Medicaid patients. And so we're seeing that undoubtedly people in those places are not getting the care that they need, but these executives are making out like gangbusters. They're just making so much money that it's, in my view, unconscionable.
Yeah, that chart showed us that Joseph Molina made $180.8 million last year. Gail Boudreau, who is the CEO of Elevance, making $24 million. Wendell, in your mind, what is the solution to this problem? What is it going to take to make healthcare more accessible and more affordable for all Americans?
Well, Congress needs to go back to the drawing board. The Affordable Care Act did take care of some problems. It did make illegal some of the practices of the insurance industry, like refusing to pay for certain treatments, or rather than not that, but they were before the Affordable Care Act, refusing to cover people at all. Now, to get around that and to maintain their profit margins, they're doing this and some other things. They're saddling people with more out-of-pocket cost than they used to. So people are having to pay more and more out of their own pockets for care before their coverage kicks in. And they're denying more claims and requests for treatment. It's really up to Congress and state legislators to pay attention, particularly when we're talking about Medicaid, because Medicaid is really run by states around the country, and they have an obligation to make sure that the people who live in those states are getting the care that they need, and that these companies are not profiteering as we're seeing.
Wendell Potter is the president at the Center for Health and Democracy. Wendell, thank you so much for your time today. Always appreciate it.
Thank you, Veronica.